on our special interview segment on Impact Yobe. We will be speaking with the Executive Secretary of Yobe State Emergency Management Agency, SEMA, Dr. Mohammed Goje. Thank you for joining us on Impact Yobe.
Thank you very much.
Let's start with emergency management in Yobe State. How will you describe it so far?
Thank you very much, Michael, for this question. In a one sentence, I would say, so far, so good and challenging. Emergency management globally, nationally, and locally comes with a lot of challenges. Looking at the dynamics of things that happen over the years, especially starting with the COVID-19 pandemic, which has hindered all sectors, and going into the climate change issues and the flooding globally, it has affected the response to emergency management, and this has to do with the experience before and how things are at the moment and why we need to change the narrative in terms of response. But by and large, in Yobe, it is successful in a way because we have started with a baseline that needs more robust investment, and that's why His Excellency Governor Malawi, when he came on board and when we presented our objectives and our targets for the years under his administration, he clearly mentioned that one, we should try as much as possible to reduce the time of emergency response so that victims will receive the first line support within the barest minimum time. And that means especially victims that need medical attention, victims that need evacuation. And secondly, His Excellency directed that SEMAs should be repositioned so much such that for every emergency response, the interface between the victims and those that will give them the succor is very close. There's not so much gap. And we have tried to reduce that, but that has come with a lot of challenges. So in summary, emergency response we have been doing our best, but it has come with a lot of challenges over the years.
All right, what kind of engagement are you having with relevant stakeholders, agencies?
Starting with relevant agencies and MDS, first, we cannot do it alone. When you say emergency response, you need the support of health-related agencies, you need the support of fire-related agencies, you need the support of traditional rulers, you need the support of religious leaders. So how we relate with them is depending on which sector is relevant to them and how it affects them. When we evacuate victims from the scene, whether flood, fire, or accident, we make sure that there's that synergy between us and the nearest hospital, and that has been established. So usually when we take our victims, first 72 hours, we treat them freely, the hospital cooperates with us, and we provide all the basic consumables that is needed to stabilize the patient before they are reunited with their families. And when we talk of fire service, of course, when there are fire incidences, when we receive the call, we link up to them, they support us in evacuating the victims and extinguishing the fire in the affected communities. So that is the importance of the synergy. And above all, the community leaders and religious leaders in terms of sensitization, especially when there are probable cases of any disaster, we alert them, we show them the high flag areas, the red zones, and they help us in mosques and churches and in community engagement meetings to sensitize the community and ask the community to be alert and to be informed. So these are the synergies between us and other government and traditionally led agencies.
All right, let's talk about flooding. What do you think can be done to mitigate future occurrence of flooding in the state?
For flooding, unfortunately, this year has been very challenging. A case study is of an old man of 70 years saying that in the whole of his life, he has never seen magnitude of this disaster. That's to tell you how how challenging is this year's flooding. But it has not come. It has not come as unexpected. It has been expected, and we cannot talk about how to mitigate flooding in future without knowing our history. For Yobe this year, despite the COVID-19 pandemic challenges, the global warming, climate change, and other things, we, in most cases, we are at the receiving end. When I say at the receiving end is when river from Kano, Hadeja flows, it flows down to Nguru, Badi, and Jakusko. And when the one from Plateau, Bauchi, Kapinzaki Dam, Birnin Kudu, Kiawa, through Gamawa, to Nangere, and again to Jakusko. And another one from Gombe, Dadinkowa, Nafada, it goes through Fika, pass through Fune with some part of Bujiba, and still goes to Jakusko again, Badi Jakusko. And there's still another one that comes from the Lake Chad through some routes. It comes to Katarko in Bujiba, it passes through Katarko to Mutai to Fune, it crosses and goes to Jakusko. So most of this water, they don't forget their channels. They flow through that route, and when it comes to high magnitude, especially this year with opening of dams, overflowing of rivers in other countries, it has compounded the impact that comes to the community. So it overflowed, and a lot of cases, a lot of high-risk areas, we send our red flags and we ask communities to evacuate at the beginning. But of course, as usual, human beings at times are resistant. Human beings at times are used to their original place of living. It is very difficult to relocate them. So it has come with a lot of negative impact. A lot of farmlands have been destroyed. A lot of households. We are still battling with embankment and relocating victims in high-risk communities. What are we doing in the future? One is to ensure that we disseminate NIMET and other reports on time. NIMET used to send their reports, we disseminate. But this time around, we will try to engage State Assembly and other key lawmakers to impose those decisions. If NIMET has sent an alert and it is glaring clear that this community will be affected, we will ensure that necessary security measure has been taken to relocate those communities on time. There's no point leaving them and at the end of the day coming back to them to rescue them during the flood. It's very difficult, and even although we may not be certain specific on all the high-risk communities, but we will try our best. And going into the future, we'll also educate our community members to go back to the ancient way of refurbishing the mud houses. Usually, when we were young, we know our grandparents used to, when the rainy season is approaching, they used to refurbish their house by making local plasters on the wall to reduce the impact of water. That has been gone. So we don't practice this tradition now. We'll try through religious leaders and community leaders reintroduce this aspect. Another thing is to create more sensitization on community members not to build on waterways, to ensure that waterways are being cleared, drainages are being cleared. Another aspect we will look into is when we receive the NIMET prediction, we will try and ensure that there are better embankments. When you guide the water through its own channel, it reduces the impact that it will go into the community. I've seen communities that we have went in Jakusko, even to evacuate them is not easy because you have to pass through 3 different canoes. And these are terrain that they have not seen water in like 50 years. So even bringing canoes to that place is another challenge. And I have seen communities that they are willing to relocate, but they said they don't know how to move with their livestock. So we have to do embankment to protect the livestock in those communities. I have been to communities that you will see a complete household, a father of 10, 11, all the household has been washed away. And he has nothing remaining. So that psychosocial trauma is there. They have lost their houses, they have lost. And worst of all is the remaining foodstuff that they have that they want to use and eat and go to the farm has been washed away. No livestock, no food reserve, no farm. They're just on their own. So it's seriously a pathetic situation, but it is the responsibility of government to see that we have cushioned that effect, and that's what we have been doing.
All right, tell us more about the project and programs of the agency. How far have you gone?
When we came on board as director by His Excellency Governor Malabuni he asks us to expand and provide the enabling environment for partners to come and operate. And that's what we have been doing. Every month we meet with partners. We had a partner coordination meeting alongside with OCHA. All UN and INGOs will come, we meet and we review our programs. Most importantly, we ask them to key into the priority of His Excellency Governor Malabuni in terms of health and education. So far, there have been tremendous success. Partners are keen to the priority of government. They've been sharing their reports. We've been monitoring their implementation. But some of the success stories are the health centers that have been constructed through our partnership with some of our partners, primary schools that have been constructed in partnership with the state government and some of our partners, and above all, the food security response we used to have through WFP, FAO, coordinated by UN, OCHA, and Action Against Hunger. This has really reduced the burden on government. During the flood season, it is so overwhelming, but when we reach out to them, they key into the government priority. If we are responding to 1,000 households, they will look at the gap and they will key into the gap in terms of wash, in terms of NFIs, in terms of food items. So this has really helped in closing and cushioning the effects of flood and other disasters. Another thing partners do in the state, as led by the state government, is in terms of ensuring that their projects are tailored towards the mandate and vision of the government. They come with projects, they come with their ideas, but we tell them these are our priorities. And we're happy that most of their projects are not cast in stone. They review it and we look at it. But it comes with challenges. For instance, now, there are places that partners want to take food items, but the bridge has been cut off by flood. So this will delay service delivery to the affected person. But when His Excellency visited one of the flood scene in Jumbam, because of no access road, he used chopper to fly to that community, commiserate with them. We lost like 10 persons in boat mishap. And he immediately directed that alternative routes should be provided. There's no reason to leave people inaccessible to life-saving services. So these are the relationship we have with them, and they have been cooperating, and we hope to strengthen more despite the challenges and limited resources globally.
All right, how does the agency cater for the people living with disability in the States?
For us, we always prioritize persons living with disability in all our responses. For instance, now in the flooding response, when we go for data collection, we ask that our team should prioritize persons living with disability. When we go for evacuation, we prioritize women, the elderly, pregnant mothers, and persons living with disability. And there are projects that come specifically tailored towards persons living with disability. Like, for instance, the federal government stipends that were given to certain households across all the states. In Yobe, we prioritize persons living with disability. But that is not enough. It's not enough in the sense that the needs are so enormous. So going into the future, we are looking at how we can conceptualize some of our partners to come up with projects that will specifically target persons living with disabilities among returning IDPs. Persons living with disabilities with low socioeconomic status, and persons living with disabilities that are on the street, that are begging. How can we help them, empower them, and so much such that they will see ability in their disabilities? There are a lot of supports that we receive, like from Red Cross in terms of supporting those that have lost their arms, and from Office of the National Security Advisor to support those that were affected by IEDs and lost one or two of their limbs. So, but these opportunities can only come if the government has provided the enabling environment and open up for the partners to come and do. And this is what we have been doing over the years, and it's yielding result. So we'll keep doing it, and we ensure that they have been given the priority they deserve.
All right, tell us more about the collaboration between the agency and development partners.
For development partners, UN are coordinated by OCHA, just like SEMA is coordinating all the partners technically. Most importantly, in Yobe, we have Ministry of Humanitarian Affairs, which is the mother ministry, and that has shown the willingness of His Excellency to give partners the room to operate. So we are consistent in our monthly review meetings, and it's not just a tea and walk away meeting. It's a meeting that we technically review what have you done, how far have you gone, and quarterly they send in their reports. We analyze the report, we share the dashboard. These partners are implementing social projects in social communities. They have done this, they have achieved this milestone. We share with the stakeholders in the local government so that they will see and justify this project has been implemented. Another interesting thing that we do with our partners is to engage them to increase and give more emphasis to localization. Partners cannot stay here forever. We want them to build local capacities. How we do that is we ensure that network of civil society organizations, SEMA and OCHA, are always in tune in emphasizing on partners to increase on localization. Localization in terms of engaging locals when it comes to employment, in terms of training locals, in terms of transfer of skills to locals. And we've been seeing results. When there are adverts, they share with us, we give to our locals, they apply, but it's a process that takes time. And of course, even if you don't have anything on table, nobody is born with capacity. People develop capacity over time. And the partners are cooperating, and you can see now a lot of local NGOs started with our local membership, and it's growing up. And this will tell you the employment opportunities our local are also having. And I believe going into the future, the transition will be smooth, so much such that we have the capacity and we can do it our own way.
All right, lastly, do you have plans for women who are heads of the family?
For every response that we do, we encourage and emphasize priorities to be given to women-headed household. An example is in one of our recovery projects in Bunyadi, one of the worst hit communities by Boko Haram. What we do is we have history that the women, if they are not encouraged, they don't go to school. If they are not encouraged, they were easily lured to join the non-state armed groups. So we support them, give them some small cash grant, so that even they can do petty trading at their doorstep, not necessarily hawking and being at a disadvantage, so that they can get something that they can go to school, something that they can buy their sanitary parts, something that they can feel that they have income at the end of the month. That is our drive going into the future.
All right. Thank you so much, sir, for joining us on Impact TV.
Thank you very much.
Thank you, sir.
Thank you.
That's all we can take on this week's episode on Impact Yobe. Don't forget to join us next week for a fresh edition of the program. My name is Michael Oshoma. Goodbye.